Acronyms are set of initials representing a name, organization, or the like, with each letter pronounced separately, of course. So let's embark on this journey to decode the world of Medicare acronyms and enhance your understanding of this critical healthcare program. Here are some common Medicare acronyms, their meanings, and the examples of use. CMS, that means Center for Medicare and Medicaid Services, meaning the federal agency responsible for administering the Medicare program and overseeing Medicaid. Well, for example, CMS recently announced changes to the Medicare Advantage plan for next year, and actually this is happening yearly, wherein it's the CMS who's in charge. So let's go to SNF, which means Skilled Nursing Facility, meaning a facility that provides skilled nursing care and rehabilitation services, often covered by Medicare Part A. Well, for example, a granddaughter has transferred to a grandmother has transferred to special needs plan after the hip surgery for rehabilitation. So after hospitalization, you go to a skilled nursing facility. So now we go to IRMA. A lot of people encountered IRMA when they sold their homes. So anyway, IRMA means income-related monthly adjustment amount. So meaning additional premiums some Medicare beneficiaries must pay their income exceeds certain thresholds. Okay, so an example for this is due to high income, you have to pay IRMA on top of your regular Medicare premiums. AEP, which is happening now, means annual enrollment period, meaning the period each year when Medicare beneficiaries can make changes to their Medicare coverage, typically from October 15 to December 7. Well, for example, try to review your Medicare plan during this AEP to ensure you still meet, your plan still meets your needs for the coming year, okay? So HIPAA, this is very important, means Health Insurance Portability and Accountability Act, meaning a federal law that protects the privacy and security of health information. An example of this is HIPAA regulations ensure that your medical records are kept confidential. So now we go to OEP, which means Open Enrollment Period, meaning this is a period when Medicare Advantage plan members can make a change to their initial plans. For example, they enroll from October 15 to December 7, and they decide to switch. This is a OEP offers a one-time switch. It occurs annually from January 1st to March 31st. So, for example, an example of this is during the OEP, you have the opportunity to switch to a different Medicare Advantage plan, and this is just a one-time switch if you need to make some changes, okay? SEP, which means Special Enrollment Period, meaning specific circumstances such as moving, losing other coverage, or becoming eligible for Medicaid can trigger an SEP, Special Enrollment Period, allowing you to make changes to your Medicare coverage outside the regular enrollment period. Well, an example of this, if you move to a new state, you may qualify for a special enrollment period to adjust your Medicare coverage based on the new location. Okay. SSA, well, in the Philippines is SSS, Social Security Services. Here it's SSA, Social Security Administration, meaning the government agency responsible for administering Social Security benefits, including Medicare enrollment. Well, an example of this is you can apply for Medicare benefits through the SSA office in your area. HMO, Health Maintenance Organization, meaning a type of Medicare Advantage plan that typically requires members to use a network of doctors and hospitals for their care. An example of this is, for example, your HMO Medicare Advantage plan offers comprehensive coverage but limits your choice of healthcare providers, based on their network, of course. PPO, which means Preferred Provider Organization, meaning another type of Medicare Advantage plan that offers more flexibility in choosing healthcare providers, but costs may vary depending on whether you are in-network or out-of-network services. An example of this is you prefer a PPO plan because you want to see any doctor you want, even if you're not in the plan or network. Evidence of coverage, meaning a document provided by Medicare Advantage and Part D plans that outlines the plan's coverage, costs, and rules for the upcoming year. Well, for example, an example of this is before enrolling in a Medicare Advantage plan, be sure to review the EOC, the evidence of coverage, to understand what's covered and what's not covered. Okay. And then there's another one, EOB, explanation of benefits, meaning a statement that Medicare sends you after you receive your healthcare services, explaining what was billed, what Medicare paid, and what you may owe. Well, an example of this is you receive an EOB from Medicare, and it shows that you have a copayment for your recent doctor's visit. Okay? PACE, Program of All-Inclusive Care for Elderly, meaning a Medicare and Medicaid program that provides comprehensive healthcare services to eligible seniors, often in a daycare setting. Well, an example of this is your grandmother is enrolled in a PACE program which offers her personalized care and support. Okay. FQHC, Federally Qualified Health Center, meaning community-based healthcare centers that receive federal funding to provide comprehensive primary care services, often servicing underserved populations, including Medicare beneficiaries. Well, an example of this is FQHC plays a vital role in ensuring access to quality health care for Medicare recipients in rural areas. And then MSP, Medicare Savings Program, meaning state programs that help eligible individuals with limited income and resources pay for Medicare premiums and other cost-sharing expenses. Well, an example of this is enrolling in a MSP can significantly reduce the financial burden of Medicare premiums for qualified individuals or beneficiaries. And then QIO, Quality Improvement Organization, meaning organizations that work under contract with Medicare to improve the quality of care provided to Medicare beneficiaries and ensure their rights are protected. Well, the example of this is the QIO in our state is responsible for monitoring healthcare quality in Medicare certified facilities. Next would be MOOP. You often hear this, what's the MOOP? This is a maximum out-of-pocket. The maximum out-of-pocket amount you can be required to pay out-of-pocket for covered services in a Medicare Advantage plan in a certain plan of the year. Well, an example of this is understanding your MOOP or the maximum out-of-pocket limit is crucial to knowing your potential financial liability in a Medicare Advantage plan. Agent of record, meaning an insurance agent. or a broker who assists individuals with enrolling in or making changes to your Medicare Advantage or Part D plans. Well, an example of this is you reach out to your AOR agent of record to help you compare Medicare Advantage plan during the annual enrollment period. And then lastly, Medigap. Medigap is a Medicare supplement insurance policy sold by private companies to fill gaps in original Medicare coverage. Well, an example of this is you purchase a Medigap policy to cover the out-of-pocket costs that Medicare doesn't cover or pay. Cancer is a formidable adversary, but there are weapons in our kitchen that can help in the fight against it. Today, we're excited to unveil the top 10 proven cancer-fighting foods that you should include in your diet. Well, join us in our journey as we explore this nutritional powerhouse and learn how they can play a crucial role in our quest to a cancer-free life. So get ready to take charge of your health with the knowledge of these 10 formidable allies in the fight against cancer. Please watch this video.
Cancer, a leading cause of death worldwide, is a complex disease that can be influenced by lifestyle factors, including diet. Research suggests that a significant percentage of all cancers can be prevented by appropriate diets, physical activity, and maintenance of appropriate body weight. A diet rich in fruits, vegetables, whole grains, and legumes can help lower the risk of many cancers. Here are the top 10 foods that can help fight and prevent cancer. Leafy greens, leafy vegetables such as spinach, kale, romaine, arugula, Swiss chard, and collards are rich in carotenoids, which act as antioxidants and boost the body's defenses. Beans. Beans are a great source of fiber and plant-based protein. They're also rich in various vitamins, minerals, and antioxidants. Nuts. Nuts are packed with protein, fiber, and healthy fats. They also contain a variety of antioxidants and compounds that may help protect against cancer. Whole grains. Whole grains are a good source of fiber and contain many important nutrients. Studies have shown that a diet high in fiber may help reduce the risk of colorectal cancer. Cruciferous vegetables. This group includes broccoli, cauliflower, cabbage, and Brussels sprouts. They contain sulforaphane, a plant compound with anti-cancer properties. Berries. Berries are rich in vitamins, minerals, and dietary fibers. They also contain antioxidants like anthocyanins, which may have anti-cancer properties. Tomatoes. Tomatoes are a great source of lycopene, an antioxidant that may help prevent prostate cancer. Garlic. Garlic and other allium vegetables such as onions and leeks contain powerful anti-cancer compounds. Turmeric. This spice contains curcumin, a chemical that has been shown to inhibit the growth of cancer cells. Green tea. Green tea is rich in antioxidants called polyphenols, which may help prevent various types of cancer. Remember, no single food can prevent cancer by itself. It's the overall pattern of your diet that matters. A diet filled with a variety of vegetables, fruits, whole grains, beans, and other plant foods can help lower your risk for many cancers. It's also important to maintain a healthy weight, be physically active, and limit your intake of alcohol, processed meats, red meats, and sugar-sweetened drinks. In addition to these foods, certain herbs and spices, such as cayenne pepper, saffron, oregano, and cinnamon, have been found to have anti-cancer properties. Including these in your diet can add flavor and health benefits. Lastly, remember that the benefits of these foods are most potent when they are part of a balanced diet. For example, one study showed that a combination of tomato and broccoli was more effective at slowing tumor growth than either tomato or broccoli alone. So, aim for a colorful, varied diet for the best protection against cancer.
Now let's go to our Medicare Q&A. First question. How does knowing the role of CMS Center for Medicare and Medicaid Services benefit Medicare beneficiaries in terms of program information and regulations? CMS is responsible for administering Medicare program. So being aware of CMS roles allows beneficiaries to access official, up-to-date information about Medicare, including changes in coverage, enrollment periods and programs updates, this helps beneficiaries stay informed about their benefits. So next is regulation understanding. CMS establishes and enforces regulation that govern Medicare. Understanding these regulations can help beneficiaries know their rights and responsibilities within the program. It ensures that they receive the benefits they are entitled to and follow the rules to maintain their coverage. Next is program integrity. CMS works to maintain the integrity of the Medicare program by preventing fraud, waste, and abuse. Beneficiaries who are aware of the CMS efforts can play a role in reporting suspicious activities contributing to the program's sustainability. Now, next we have the complaint resolution. If beneficiaries encounter issues or disputes with healthcare providers or Medicare Advantage plans, CMS provides a process of complaint resolution. Knowing how to navigate their process can help the beneficiaries address problems and seek resolutions effectively. Then enrollment guidance. CMS provides guidance on the various aspects of Medicare enrollment, including initial enrollment, special enrollment periods, and the annual enrollment period. Beneficiaries who understand CMS rules can make informed choices about their coverage options. Well, access to resources. CMS offers numerous resources such as educational materials, online tools, and customer support to assist beneficiaries. Well, being aware of these resources enables beneficiaries to seek help when they need and make informed decisions about their health care. In summary, knowing the role of CMS in Medicare assures that beneficiaries can have access to an accurate information, understand program regulations, and can navigate the system effectively. It empowers them to make informed decisions about their healthcare coverage and rights within the Medicare program. Well, next, let's go to the next question. Explain the significance of knowing the various Medicare acronyms when making informed decisions during Medicare open enrollment period. Well, knowing the various Medicare acronyms is significant when making informed decisions during the Medicare open enrollment period. Well, for several reasons. Well, plan comparison. During the open enrollment period, beneficiaries can review and change their Medicare coverage options. Understanding acronyms like Part A, Part B, Part C, Part D helps beneficiaries compare their different types of plans, original Medicare versus Medicare Advantage, and drug coverage options. Cost evaluation. Well, acronyms such as IRMA or Income-Related Monthly Adjustment Amount can be crucial for high-income beneficiaries. Knowing how IRMA works helps them access the potential impact on their premiums and make cost-effective decisions. Specialized plans. Some beneficiaries, such as those with specific healthcare needs, may benefit from SNP, Special Needs Plans. Understanding this acronym helps them explore specialized plans tailored to their unique requirements. Supplemental coverage or Medigap plans assist beneficiaries in finding supplemental insurance to fill gaps in their original Medicare coverage, potentially reducing out-of-pocket costs. Prescription drug coverage. Beneficiaries who take medication should understand Part D and how it affects their drug coverage. This knowledge helps them select a Part D plan that covers their specific medications and at, of course, a reasonable cost. And then government agencies recognizing CMS or Center for Medicaid Services and its role in administering Medicare ensures that beneficiaries can access official resources, regulations, and programs updates during the open enrollment period. So, low-income assistance. Understanding QMB or Qualified Medicare Beneficiaries and other low-income assistance programs helps eligible beneficiaries access additional support to cover Medicare costs. Enrollment guidance. Knowledge of Social Security SSA or Social Security Administration involvement in the Medicare enrollment is essential as beneficiaries often enroll in the Medicare through the Social Security. Understanding this process ensures timely and accurate enrollment. Take note. So, informed choices. Overall, familiarity with these acronyms empowers beneficiaries to make informed decisions about their healthcare coverage during the open enrollment period. It allows them to select the plans and options that best suits their individual healthcare needs and financial circumstances. In conclusion, knowing Medicare acronyms is the key to making well-informed decisions during the Medicare open enrollment period. It simplifies the process of evaluating and selecting the most suitable coverage options, ensuring that beneficiaries receive the care they need while managing costs effectively. As we wrap up Maria Cares episode 20, I would like to remind you that there's an ongoing annual enrollment period for Medicare Part C or Medicare Advantage. If you would like to meet me to review your Medicare options, I can meet you at the Seafood City on Maryland Parkway here in Las Vegas. You can see me there on Tuesdays and Thursdays during the entire AEP enrollment from 1 o'clock to 5 o'clock. I want to extend my heartfelt thank you to my dedicated production team who worked tirelessly behind the scenes. In this episode, we delve into the world of Medicare acronyms, addressing questions and shedding light in this complex topic. Stay tuned for more informative content in the future, and remember that Maria Cares is here to provide you with valuable insights on healthcare and more. Until then, take care, stay informed, and remember that together we can build a brighter future for our seniors. Thank you for my loyal viewers for joining us on this journey of senior information and care. Your trust and support mean the world to me. I would like to send my love, hugs, and kisses to my clients. And to those who are looking for a reliable agent, I'm looking forward to becoming a part of your Medicare journey. This is Maria Garcia of Maria Cares saying, take care of your health. That's the only thing you got. Let's join hands for better health.